Welcome back to another episode of FMA-TV, your source for FMA news and information. I'm your host, Vanessa Dakin, Associate Director of Membership Development for the Florida Medical Association. Today I want to introduce you to the Florida Medical Association's charitable arm, the FMA Foundation. The FMA Foundation is dedicated to philanthropy on the behalf of medical profession. It funds public health programs, medical school scholarships, and leadership initiatives. Over the past decade, the foundation has provided more than $402,000 in scholarships to medical school students. When catastrophes like Hurricane Katrina and the Haiti earthquake struck, the foundation supported disaster relief efforts. And recently, with a generous grant from the Physicians Foundation, the FMA Foundation has launched the Physician Leadership Academy to identify and groom the next generation of medical leaders. The list goes on and on. So here to tell us more about the FMA Foundation and its mission is Development Coordinator Colette Podgorski. Welcome, Colette, and thank you for joining us.
Hi, Vanessa. Thanks for having us and giving us this opportunity to talk about Foundation.
Colette, what are the Foundation's priorities for this coming year? And actually, what is the mission of the FMA Foundation?
The Florida Medical Association Foundation mission statement is to help physicians practice medicine by supporting global health, medical education, and professional development. This year, we'll need to raise over $300,000 to effectively carry out the mission. We want to remind you that every dollar that you donate is tax deductible and greatly appreciated.
Now, the Physician Leadership Academy is the new initiative designed to train young physicians to become leaders of the profession. Colette, how did this program actually come about?
Due to the changes brought on by national healthcare reform, there will be an increasing demand for physician leaders. And as our current physicians retire, we'll need to identify and train the new leaders and give them the tools necessary to succeed.
What is the Leadership Academy's ultimate goal?
Throughout the year, the participants will focus on leadership development, such as change, culture, communication skills, and their own individual development. Our goal is that each of the participants will take an active role within the FMA or within the FMA Foundation.
That's wonderful. I personally think the Physician Leadership Academy is a wonderful new program, and it's just another shining example of how the Foundation helps physicians practice medicine. So thank you, Colette, for taking the time to speak with us today. The FMA Foundation wouldn't be able to offer such wonderful programs without strong FMA leaders like Foundation President Dr. Vincent DeGennaro. Dr. DeGennaro and teams of physicians have made more than 15 trips to Haiti and performed more than 400 surgeries there. Following the 2010 January earthquake in Haiti, these dedicated volunteers focused their efforts on providing ongoing disaster relief through the Foundation's Help for Haiti project. And here with us today to speak about the Foundation's Help for Haiti project is Dr. DeGennaro. Hi, Dr. DeGennaro. Thank you for joining us.
Thank you for having me here.
Dr. DeGennaro, you were the driving force behind the Foundation's Help for Haiti project after the horrific earthquake in January 2010. However, you had actually been participating in medical missions in Haiti long before the earthquake. How did you get involved in those efforts?
With a group called Project MediShare, which was founded by Barth Green at the University of Miami, and my son was a medical student there some years ago, 6 or 7 now, and he had always wanted to go to Haiti because of his contact at Notre Dame, which had a clinic outside of Port-au-Prince. And when he was a second-year student, I agreed to go with him. My daughter, who was a first-year student, also went. So the three of us went on a medical mission to the Central Plateau of Haiti, and that kind of started the involvement. From there, we developed a surgery program, and from there we developed a cleft lip and palate program with Dr. Seth Thaler, the chairman of plastic surgery at the University of Miami, and that kind of got us started.
That is just wonderful. I have often noticed, though, that when time passes after a tragedy, donations begin to tail off. Not because people don't care, it just becomes a distant memory. So why is it so important for FMA physicians to continue donating services, medical supplies, and funding to Haiti through the FMA Foundation?
Well, you're absolutely right. The problem of healthcare in Haiti did not start with the earthquake. The earthquake just superimposed an acute event on a chronic problem. And it did raise the awareness for a while, and it did give us an opportunity to raise some money and solicit some volunteers, but it also gave us the opportunity to upgrade the program that we had going on and get a better source of funds and a better source of volunteers. So the importance is, while we were doing earthquake relief 2 or 3 months ago, we're now doing continuing medical care. We're in there for the long term. And so we need a continuing source of funds and volunteers and doctors and nurses, et cetera. So this is a great opportunity, having raised the level of awareness, to sustain the program.
How have other FMA physicians responded since the launch of Help for Haiti?
We've had an enormous response, both financially and with volunteers. We had many come to Haiti. We have a website. We established the website early on through the FMA, which was linked into the University of Miami website for volunteers. And we had many FMA members serve in a caregiving capacity in all specialties.
That's wonderful to hear. Of course, the Foundation supports many other good causes, such as medical school scholarships for FMA student members. How would you describe the FMA Foundation's overall mission?
Well, we are going to expand our mission. We have many arms, if you will, medical student scholarships. The Alliance plays an important role in the Foundation. They have a block grant program where they go into communities and give grants for things like school health programs, HIV education. They're at the grassroots in the community doing work. We are involved in almost any area of health. That's our mission. Anything that promotes health and education through any of our arms is something that we're going to try to improve.
So our members know, how can they get involved? How can they help the FMA Foundation?
They can get involved by getting involved. We need people, we need ideas, we need people to promote and execute those ideas. We need people that will go out and help us raise funds. Anything that, this is an opportunity for people to get involved in the FMA who might not be particularly interested in politics or some of the other things that we do. This is another vehicle to promote organized medicine, get our names out in the community. When you sit down with a legislator or with a school principal and you show them that you're capable of funding a program for minority students, they think a little differently about the physicians. Physician involvement in the community has always gone on, but it's never really gone on in a way that promotes the physicians as a group.
Dr. DeGennaro, thank you so much for taking the time to tell members about the FMA Foundation. I know you have a busy schedule, so thank you.
You're welcome, and thank you for having me.
For more information or to make a donation to the FMA Foundation, visit www.flmedical.org or call 1-800-762-0233. Please remember that when you donate to the FMA Foundation, you directly support programs that strengthen the medical profession, and you help save the lives of people in need. That wraps up another edition of FMA-TV. Thank you for tuning in, and I'll see you soon.